Hey everyone, and welcome back to the KenkoVibe podcast. I'm Ethan Reed,
And I'm Grace Morgan.
and we are ready for another deep dive.
I was thinking about this the other day.
Oh yeah.
Can hitting the gym, really hard mess things up in the bedroom?
You mean like
Yeah. Like, does intense exercise make you more likely to have, ED?
erectile dysfunction? That's a good question and a common concern. It seems like a lot of guys worry about that.
For sure. So what's the verdict?
Well, the good news is that intense exercise is actually more likely to reduce the risk factors for ED.
Oh, okay. That's good to hear.
Things like obesity and poor cardiovascular health, those are big culprits when it comes to ED.
Yeah.
And exercise helps combat those.
Right. So basically staying in shape is good for, your overall health.
Exactly.
Which then helps with your, sexual health too. Makes sense.
It's all connected. And speaking of overall health, cardiovascular exercise in particular seems to be really good for healthy sexual function.
Interesting. So that's like running, biking, swimming, that sort of thing. Exactly. Activities that get your heart rate up and improve blood flow.
Makes sense.
Yeah.
So if someone's already experiencing ED, can exercise actually help improve things?
That's what the research suggests. There's evidence that sufficient exercise, especially cardio, can actually decrease erectile issues in men who are already dealing with ED.
Wow. So it's not just preventative. It can be therapeutic too.
Right. It's all about creating a more favorable environment for healthy sexual function by addressing those risk factors we talked about.
Okay, that makes a lot of sense. We've talked a lot about cardio, but what about weightlifting? Does that have any specific benefits when it comes to ED?
There's some research showing that combining aerobic exercise with resistance training, like weightlifting, can actually lead to some pretty significant improvements in erectile health.
Oh, really? How significant are we talking?
Some studies have shown improvements of up to 15% in erectile function in men who added weightlifting to their routine.
15%. That's pretty impressive. What's the mechanism there? How does lifting weights translate to better, performance?
Well, weightlifting increases nitric oxide activity in the body.
Nitric oxide.
What does that do?
Nitric oxide is crucial for blood flow because it helps your blood vessels relax and widen.
Ah, I see. And good blood flow is obviously key for,
For erections.
Exactly. Got it. Makes sense. So it's all about getting that blood flowing where it needs to go.
Precisely. Plus, weightlifting can also boost testosterone levels, which further supports healthy erectile function.
Okay, so we've talked about all the good stuff. Now let's address the elephant in the room. Is there any why truth to the fear that too much exercise can actually cause ED?
Well, it's important to remember that anything taken to an extreme can have downsides. If you're pushing yourself to the point of collapsing or getting injured, that's obviously going to impact your sexual activity, at least in the short term.
Yeah, no kidding. So what about like moderate to high levels of intense exercise? Is there a tipping point where things start to go downhill?
There's actually an interesting caveat when it comes to cycling.
Cycling. What about it? While it's generally considered low impact, there's some evidence suggesting that it could contribute to nerve damage in the pelvic area, which could then lead to ED.
Wait, really? That's surprising. Are there any ways for cycling enthusiasts to minimize that risk?
Absolutely. Adjusting your riding style and making sure you have a properly fitted bike seat can help prevent that kind of nerve damage.
Okay, so even with exercise, it seems like balance is key.
Right?
Right? Not going completely overboard and listening to your body.
Exactly. And there is also research that has found a link between very high levels of intense exercise and lower sex drive in men.
Interesting. So there's a sweet spot when it comes to physical activity and libido.
It seems that way.
So to sum it up,
Mm-hmm.
it sounds like there's not a direct causal link between exercise and ED,
Right.
but there's the potential for reduced desire or even temporary performance issues with really extreme activity.
That's a good way to put it. But for the vast majority of men, the positive impacts of exercise on sexual health far outweigh any potential risks.
Okay, that's good to know.
It is. It really is.
So we can all breathe a sigh of relief and keep hitting the gym.
Within reason, of course.
Of course, moderation in all things, right?
Absolutely.
All right, well, that's a great place to take a quick break. We'll be right back to continue our deep dive into exercise and ED. Stay tuned. All right, so we've covered exercise pretty thoroughly. But what about other things men can do to, address ED? Are there any lifestyle changes or options besides hitting the gym?
You're absolutely right. It's not just about physical activity. A holistic approach to well-being is key here.
Holistic approach. I like that.
Yeah.
So what else should guys be focusing on besides maybe laying off the extreme Ironman training?
Well, good sleep is huge. Managing stress levels and a healthy diet are all crucial components of sexual health, too.
That's good advice for all of us, really, not just men dealing with ED.
Exactly. It's about overall well-being. And then, of course, there are medications that can be incredibly helpful in treating ED, especially when it's related to vascular function, which is often the case.
Medications. Okay, let's talk about that. What kind of medications are we talking about?
The most common type is called PDE5 inhibitors. These work by relaxing the muscles in the blood vessels of the penis.
Okay, so that helps with
It
that.
improves blood flow to the erectile tissues. You've probably heard of some of the more well-known brands like Viagra and Cialis.
Right, Viagra and Cialis, those are definitely household names.
Yeah.
I'm curious about something I've seen advertised, though. Those Hims chewable hard mints.
Oh, yeah.
How do those compare to the traditional pills?
Those mints actually contain the same active ingredients as Viagra and Cialis,
Wow.
just in a different, more discreet form.
Interesting. So it's the same medication, just a different delivery method. What about effectiveness? Are they as effective as the pills?
Yes, they generally have the same level of effectiveness. And the good news is that PDE5 inhibitors, regardless of form, have a pretty high success rate. Studies have shown that about 70% of men see significant benefits from using them.
That's a pretty impressive statistic.
Yeah,
But we've also talked about the psychological side of things.
right.
How does mental health play into ED?
It's a huge factor. Psychological causes of ED are actually quite common, particularly among younger men. Things like anxiety, depression, relationship issues, and even just everyday stress can all contribute to difficulties in the bedroom.
So it's not always a purely physical issue. Sometimes it's more about what's going on in our heads.
Absolutely. And that's why therapy can be such an effective way to address ED, especially if it's rooted in psychological factors.
Therapy. Okay, so what types of therapy are particularly helpful for ED?
Well, cognitive behavioral therapy, or CBT, is often recommended. It helps identify and change negative thought patterns that contribute to anxiety and performance issues. Another approach is sex therapy, which specifically addresses concerns related to sexual function and intimacy. And sometimes couples therapy can be beneficial as it helps partners communicate more effectively and work together to overcome challenges.
So it seems like there's a whole range of options when it comes to therapy, which is great because everyone's situation is different. Okay, so let's shift gears a bit and get more practical. Let's say someone is experiencing ED after working out. What should they do?
First and foremost, anyone dealing with ED, regardless of the circumstances, should consult with a healthcare professional.
So don't just ignore it or hope it goes away on its own.
Exactly. It's important to address it, and time is of the essence.
Why is it so time sensitive?
Well, for one, ED can sometimes be an early warning sign of more serious underlying health issues like heart disease or diabetes. Addressing ED early on can help identify and manage those conditions before they become more severe.
Wow, I didn't realize that. So getting checked out for ED could potentially uncover other health concerns as well.
That's right. It's always better to err on the side of caution and get a professional opinion. Plus, there's no need to suffer in silence. There are effective treatments available, and you deserve to have a healthy and fulfilling sex life.
Absolutely.
Mhm.
So to recap, exercise can be a fantastic way to help prevent ED. But if you're experiencing issues, especially after intense exercise, it's crucial to talk to a doctor.
I couldn't agree more. And if you're looking for personalized guidance and treatment options, it's a good idea to consult with a urologist. They specialize in men's reproductive and urinary health, including ED.
Okay? A urologist.
Yeah. They can help determine the underlying cause of your ED and recommend the best course of action, whether it's lifestyle changes, medication therapy, or a combination of approaches.
That makes a lot of sense.
Yeah.
So guys, if you're struggling with this, don't hesitate to reach out to a urologist. They can help you get to the bottom of things and find the right treatment plan for you.
Exactly. And remember, there are effective treatment options available. You don't have to just live with ED.
That's so important.
Yeah.
You know, it's about taking control of your health and not being afraid to ask for help.
I couldn't agree more. It's about feeling good and confident in all areas of your life.
Well, Grace, this has been a fascinating deep dive into exercise and ED. I know I've learned a lot, and I hope our listeners have too. Thanks for being here.
My pleasure, Ethan. I always enjoy talking about this stuff.
So to wrap things up for everyone listening, I'm Ethan Reed.
And I'm Grace Morgan.
And this has been the KenkoVibe podcast. Remember to subscribe, like, comment, and share this episode with anyone you think might find it helpful. And here's something to think about. Could there be a connection between the type of exercise you choose and your overall mental well-being, which in turn could affect your sexual function? Something to ponder. Until next time, stay curious and keep those vibes high.